pain. Oh man. Oh, my stomach hurt in my left lower stomach. Oh man. I got worsening cramps. It's just getting worse day by day. Oh, I got diarrhea. Oh.
If you have worsening cramps, abdominal pain, diarrhea, constipation, or pain in your lower left abdomen, you might have irritable bowel syndrome, also known as IBS. Irritable bowel syndrome is a functional GI disorder that causes chronic or recurrent constipation, diarrhea, and/or abdominal pain. The etiology is unclear. However, research suggests that a combination of environmental, immunologic, genetic, hormonal, and stress factors play a role in the development and course of the disease.
Oh, I feel so much better. It's still some pain. Oh man, finding out I got IBS, it really hinders my ability to hang with my family. I can't play with my grandkids like I want to. I can't go dancing with my wife because I'm afraid that I won't have access to a bathroom. I wish it was something I could take to help me with my IBS symptoms.
Well, Mr. Nance, I have the perfect drug for you. It's called diphenoxylate atropine, also known as Lomotil. So the uses for Lomotil is it slows intestinal motility and propulsion. It's an adjunctive therapy in the treatment of diarrhea. Some adverse effects is dizziness, confusion, drowsiness, headache, insomnia, nervousness, tachycardia, flushing, blurred or dry eyes, constipation, dry mouth, epigastric distress, nausea, vomiting, or urinary retention. Just be mindful that older adults are more sensitive to the side effects. Some nursing implications. As a nurse, I would have to monitor liver function because this drug may cause an increase in serum amylase concentrate. I want to monitor for signs and symptoms of dehydration. I want to monitor for frequency and consistency of stools and auscultate bowel sounds. I want to assess the gastrointestinal function, report abdominal distension, and signs of decreased peristalsis. I want to caution with patients with angle closure, glaucoma, and I also want to caution with patients who are or were physically dependent on opioids. I want to be sure to evaluate the patient's fluid and electrolyte balance and skin turgor as well for the dehydration. You can take Lomotil by mouth, starting at 5 milligrams 3 to 4 times daily initially, then 5 milligrams 1 time a day as needed. You do not want to exceed 20 milligrams per day. The onset is 45 to 60 minutes, the peak is 2 hours, and the duration is 3 to 4 hours. Alright, Mr. Nance, so just to teach you a little bit about this medication, I want to instruct you to take this medication as directed. Do not take more than the prescribed amount because of the habit-forming potential. This dosage should be taken as soon as possible, unless it's almost time for your next dose, and you do not want to double doses. This medication may cause drowsiness, so I want to advise you to avoid driving or any other activities requiring alertness until your response to the drug is known.
Well, I don't have to worry about driving anyways. My daughter usually drives me everywhere. So the fact that I get a little drowsy from the medicine shouldn't be a problem.
I want to advise you that frequent mouth rinses, good oral hygiene, and sugarless gum or candy may relieve your dry mouth symptoms from the medication.
Well, I always brush my teeth and my dentures twice a day. And I have some Trident sugarless gum, so that should help too, like you said, with my dry mouth.
Using alcohol or tobacco with certain medications like Lomotil may cause interactions to occur, so it's important to talk to your doctor to let them know.
Okay, because you see I got a pipe of tobacco here, so, I do have to caution with alcohol and tobacco, so I'm going to make sure I tell my doctor about me smoking tobacco. And I'll let him know he can tell me what I need to do.
I also want to advise you to inform your healthcare professional of any medication regimen prior to treatment.
Alright, yeah, I do take a few other pills for my medication regimen, so I'll be sure to incorporate that with my physician nurse so I can let him know what other pills I need to take.
I also want to instruct you to notify your healthcare professional if diarrhea persists or if fever, abdominal pain, or palpitations occur.
Oh, I really hope the diarrhea doesn't persist but if I do get constant more diarrhea and a fever with abdominal pain and palpitations, I'll be sure to call my doctor again to let him know that I'm having these problems. Thank you, nurse, for teaching me more about the Lomotil medication. I'm excited to get this for my IBS.
24 hours later.